just a quick review of the Game Changer Unloader knee brace. So this brace is made specifically for people that are having some kind of knee problem or some kind of knee pain. And the idea here is that you put on the brace, excuse me, and it supports the joint, helps support the muscles around the knee, and it restricts your motion a certain amount. So that way your knee has a chance to rest, recover, and doesn't get so overstressed as you're doing a lot of things. So a few points about this particular brace. It does have push button release, which I really like. So you just press each button and the thing pops open. Also means once you get it adjusted, you can snap the things back up. You don't have to worry about readjusting it every time. And like I say, it's easy off, just hit the buttons. The other thing to know that this is left or right dedicated, meaning that you do, some of these braces and these sleeves, they work on either the right or the left knee, but this one doesn't. So this one you have to buy a right one or either buy a left one. So just good to know. Anyway, other things you can do besides wear a knee brace if you're having problems. I'm just getting this from Bulletproof Your Knee book, just one resource. If you're having any kind of knee problem, make sure that you're strengthening your quadriceps muscle. I'll show you a picture of the quadriceps. It's a big muscle on the top of your leg. Here's your kneecap for reference. This is a big stabilizer of your knee. And what researchers are finding, if you take people with various knee problems and you muscle test all the muscles around the knee, it's just the quads that take the hit. In other words, the quads are weaker than they should be. And studies that are taking like CT scans and looking at cross-sectional area of the muscle find that it's actually smaller than normal. So to get better, you got to get that thing in shape. So for instance, knee swelling in the quadriceps. Another study demonstrated that even if you have as little as 20 milliliters of fluid in your knee, now that's just over a tablespoon, it's enough to decrease the strength of your quadriceps muscle. So if you're having any kind of swelling in your knee, acute or chronic, chances are your quadriceps muscle's taking a hit. Knee injuries in the quadriceps, if any kind of surgical opening of the knee joint, any knee surgery, you've broken your tibia. Researchers look at these people, they find, their quadricep muscle are a lot weaker than they should be. Here's the big one, ligament problems in the quadriceps, anterior cruciate ligament, that's called your ACL. You've heard of football players tearing their ACL, or soccer players. One study looked at people who had completely ruptured their ACL. Researchers found that the strength of their quadricep muscle in the injured leg was decreased by 25 to 30%. So you've got a muscle that's the main stabilizer of your knee, and you've knocked its strength down 25 to 30%. Kind of hard to get better and pain-free if you don't get that thing back up to par. Posterior cruciate ligament, same thing, medial collateral ligament. Knee pain, if you have chronic pain, they find that, that can take its toll on the quadriceps. Knee arthritis in the quadriceps. So if you Google like knee arthritis and quadriceps, it's pretty consistent in the literature that if you take a group of people with knee arthritis and you muscle test their quads, that they're a lot weaker than they should be. Sometimes it's comparing right to left, sometimes it's just comparing, a case-controlled study. But anyway, the interesting thing is randomized controlled trials showing that if you take a group of people with knee arthritis and you strengthen just their quads, their knee pain starts to go away. And other things researchers are finding that if you, the people with the strongest quads have the least progression over time of their knee arthritis. So it kind of, interrupts the whole pathological process that goes on. Patellofemoral pain syndrome in the quadriceps. This goes on and on. Any kind of knee problem, definitely make sure that you're strengthening your quadriceps. At least do one exercise for it. Fine-tune control over your knee. Here they're talking about your hip. A lot of times you have bad knee pain and there's nothing absolutely wrong with your knee. It has to do with some dysfunction going on at your hip. Classic case is iliotibial band syndrome. People have pain at the side of their knee. You take a group of people with iliotibial band syndrome and you muscle test their hip abductors. They find they're unusually weak, a lot weaker than they're supposed to be. And here again, just like with knee arthritis, take a group of people with iliotibial band syndrome, strengthen their hip abductors, iliotibial band syndrome starts to go away. So interesting. Optimize knee flexibility. Everybody knows your knee needs to be able to bend and straighten fully. What most people don't know is that your knee actually rotates. So about the last 10 to 15 degrees of you straightening your leg out, your knee actually rotates laterally or out to the side. So here's a little test to see if you have that motion. So that's an accessory motion. You really need to have a fully functioning knee. Increasing dynamic knee stability. Here they're talking about proprioception. So if I suddenly turn off the lights, you'd be able to tell me more than likely whether your knee is bent or straight. And that's because you have these little joint receptors and receptors in the muscle that actually give your brain constant feedback as to where your knee is in space. What they're finding is that you take people with various knee problems and they have decreased proprioception. Now it's not like they don't know where their knee is, it's just it's not up to where it should be. And so this has implications for, like, let's say if you step in a hole unexpectedly or off a curb, You need to know where your knee is right away, instantly, so that you can contract your quads and stabilize your knee before any damage occurs. So anyway, other things you can do for your knee. But yeah, hey, nothing's as quick as putting on a brace. Put it on. Most people report they get pain relief right away. So it's a good brace. Check it out.